So, hello student, very good morning to everyone. So, today I'm going to start new chapter, that is anti-diabetic drugs. So, so this diabetes is the most common disease in nowadays. So this is most common disease. So we'll see first what is diabetes. So it is also called as diabetes mellitus. So diabetes mellitus, it is a chronic metabolic disease caused by variable combination of two pathogenic factors, that is insulin deficiency and insulin resistance. So diabetes, the definition of diabetes is diabetes mellitus, it is a chronic metabolic disease caused by variable combination of two pathogenic factors, that is insulin deficiency and insulin resistance. So uh, that result in disordered utilization and storage of carbohydrates, protein and fats, and reduce the production of energy. So in your pancreas, the different types of cells are there, that is alpha, beta, and D cells. So the different cells of pancreas produce different compound, and that compound having different functions. So we'll see that each cell one by one. So first cell is alpha cell. So the role of this alpha cell is it produces the glucagon, which promotes the conversion of glycogen into glucose. And when the energy meet the when required to meet the energy need of the body, so when your body require energy, so this conversion takes place. The role of this alpha cell is that it produces glucagon, and the role of this glucagon is it promotes the conversion of glycogen. It promotes the conversion of glycogen into glucose. So when required to meet the energy needs of the body, so this is the function of this alpha cell. Then the next cell is beta cell. So beta cell produces insulin, which removes the excess of glucose from the body and convert it into glycogen. So the role of this beta cell is that it produces insulin and it removes the excess of glucose from the body and convert it into glycogen. This is the function of beta cell. Then last one is D cell. So the function of this D cell is it produces somatostatin, which maintains the proper proportion of insulin and glucagon. So this is the function of D cell. It produces somatostatin, which maintains the proper proportion of insulin and glucagon. So your pancreas having different cell, and that uh, it produces following compounds which have different functions. So alpha cell, it produces glucagon, which promotes the conversion of glycogen into glucose, which are required to meet the energy needs of the body. Then B cell, it produces insulin, which removes the excess of glucose from the body and convert it into glycogen. And third one is a D cell. It produces somatostatin, which maintain the proper proportion of insulin and glucagon. So in normal person, what happen? There is a coordination in the functioning of this cell, that is alpha, beta, and D cell. So in the normal person, there is a coordination in the functioning of these cells. But what happened? But due to the onset of diabetes, this equilibrium is disturbed, as the insulin is not produced or it is insufficient. So due to the onset of diabetes, this equilibrium is disturbed as the insulin is not produced or it is insufficient. So insulin controls the metabolism of carbohydrates, lipid and proteins. The main function of this insulin is it promotes the metabolism of carbohydrates, lipids and proteins. So in absence of this insulin, in absence of this insulin, glucose is not metabolized at a normal rate because insulin removes the excess of glucose. So if insulin is not in your body, so what happens, the glucose is not metabolized at a normal rate, hence there is increase in the concentration of glucose in your blood and causing the condition that is called as hyperglycemia. So that condition, the increase in the concentration of glucose in blood causing the condition called as hyperglycemia. Thus the blood glucose level rises above the normal level, which is 60 to 90 mg per ml. So in normal person, what happens, there is a coordination in the functioning of this cell, that is alpha, beta and D cell. But due to the onset of diabetes, this equilibrium is disturbed as insulin is not produced, it is insufficient. Insulin controls the metabolism of carbohydrates, lipids and proteins. In absence of insulin, glucose is not metabolized at a normal rate. Hence, there is an increase in the concentration of glucose in the blood, causing the condition that is called as hyperglycemia. So the condition in which there is an increase in the concentration of glucose in the blood, that condition is called as hyperglycemia, and the blood glucose level rises above the normal level, and the normal level is 60 to 90 mg per 100 ml. And in this slide we will see the symptoms of diabetes mellitus. So the symptoms of diabetes mellitus is due to the higher blood glucose concentration, the osmotic pressure increases, and due to this there is an increase in the blood volume and consequently the urine output increases, that is called as polyuria. So this is the first symptom. Due to the higher glucose concentration, the osmotic pressure increases, and due to this there is an increase in the blood volume and consequently the urine output increases, that is called as polyuria. The second symptoms is the loss of water from the body leads to increase in the thirst, that is called as polydyspia. So there is excessive loss of water from your body and that leads to thirst, that is called as polydyspia. The second symptom. And the third one is as the blood glucose level exceeds its renal threshold, glucose appear in the urine, that is called as glucosaria. So what happens, the glucose level increases, the glucose level exceeds its renal threshold and glucose appear in urine, that is called as that term is called as glucosuria. And uh, next symptoms is the ketone bodies appear in the blood, that is called as ketonemia, and it is also in the urine, that is called as ketonuria. So this ketone body appear in blood as well as urine. So if it appear in blood, that is called as ketonemia, and if this ketone body appear in urine, that is called as ketonuria. And the next symptoms is as the glucose cannot enter some tissues, energy is derived by breaking down of proteins and fats as an alternative, and this result in weakness and weight loss. So what happens, As the glucose cannot enter some tissues, energy is derived by breaking down of protein and fats as an alternative. So this glucose will not enter in some tissue. So the energy is derived by breaking down the protein and fats as an alternative. So this result in muscular weakness and weight loss. Then the next your symptoms is in chronic cases there is a degradation of walls and membrane of blood vessel, especially fine capillaries in limbs and causes condition called as diabetic foot. So in chronic cases there is a degradation of walls and the membrane of blood vessels, especially fine capillaries in limbs and causes condition, that condition is called as diabetic foot. The last the symptoms is long standing diabetes causes glaucoma, that is called as increase in pressure on eyeball which leads to blindness. So in long standing diabetes there is increase in pressure on eyeball which leads to blindness. So these are the different symptoms of diabetes mellitus. So due to higher blood glucose concentration, the osmotic pressure increases, and due to there is increase in blood volume, and consequently the urine output increases. That is called as polyuria. The loss of water from the body leads to increase in thirst. That is called as polydyspia. Then, as the blood glucose level exceeds its renal threshold, glucose appear in urine. That is called as glucosaria. Then the ketone bodies appear in the blood, that is called as ketonemia, and also in the urine, that is called as ketonuria. As glucose cannot enter some tissues, energy is derived by breaking down proteins and fats as an alternative. This results in muscular weakness and weight loss. In chronic cases there is a degradation, uh, there is a degermination, it's not a degradation, there is a degermination. So in chronic cases there is a degermination, it's a degeneration, degeneration. Degeneration. So in chronic cases there is a degeneration of walls of and membranes of blood vessels, especially capillaries in limbs, causes condition that is called as diabetic foot. Then long standing diabetes causes increase in the pressure on eyeball which leads to blindness. So these are the symptoms of diabetes mellitus. Then the next point is types of diabetic mellitus. So this diabetic mellitus has four types. So we'll see one by one in detail. So type 1 or juvenile onset diabetes, type 1 diabetes, or it is also called as juvenile onset diabetes. So in this type of diabetes, that is type 1 diabetes, in juvenile diabetes, the hyperglycemia, glucosuria, polyuria, and polydyspia develop rapidly. So in type 1 juvenile the diabetes, the hyperglycemia, then glucosuria, polyuria, polydyspia develop rapidly, and these diabetic lack the ability to synthesize and secrete the insulin and depend on the administration of insulin for survival. So in this type of diabetes, juvenile diabetes, the the hyperglycemia, glucosuria, polyuria, polydipsia develop rapidly, and this diabetic lacks the ability to synthesize and secrete the insulin, and that person will depend on the administration of insulin, on external insulin for survival. So this is all about type 1 or juvenile onset diabetes. So juvenile diabetes, the hyperglycemia, glucosuria, polyuria, and polydipsia develop rapidly. This diabetes, these diabetics lacks the ability to synthesize and secrete insulin and depend on the administration of insulin for survival. Then second one is type second or maturity onset, type second or maturity onset diabetes. So this form offers the people over 40 age, and the symptom develops slowly. So this type of diabetes occurs in the person whose age is more than 40, and the symptoms develop slowly. Obesity is the often contributory factor. So obesity is the most important factor for causing this maturity onset diabetes or type second diabetes. So this type of diabetes can synthesize and secrete the insulin. So the important point is, in this type, that the diabetic patient synthesizes and secretes the insulin, but it is in a insufficient quantity. But it is in a insufficient quantity to sustain the normal metabolism. To sustain normal metabolism. So this is a milder form of diabetes, which leads which less with less ketosis. So this is a milder form of diabetes with less ketosis. The disease can be controlled by dietary regulation. So this type second diabetes can be controlled by dietary regulation, or with or without use of oral anti-diabetic drugs. So it can be controlled by dietary regulation, or without use of any without use of any oral diabetic drugs. So this is all about the type second or maturity onset diabetes. So this form offers the people over 40, and the symptoms develop slowly. So it requires time to develop the symptoms, and obesity is the contributory factor. And this type of diabetics can synthesize and secrete the insulin, but it is in an insufficient quantity to sustain normal metabolism. And this is the milder form of diabetes with less ketosis. The disease can be controlled by dietary regulation. So this type second diabetes can be controlled by dietary regulation, or with or without use of anti-diabetic drugs. So this is about maturity onset diabetes. The third one is type third diabetes. So it is caused by the indirect factor. So it is caused by the indirect factor such as abnormality in insulin receptor, pancreatic disease, and the hormonal imbalance. So in the type third diabetes, it is caused by the indirect factors such as abnormality in the insulin receptor, pancreatic disease, and the hormonal imbalance. It may also be induced by prolonged use of highly potent and toxic drugs. So this type third diabetes, it is caused due to indirect factors such as abnormality in the insulin receptor. So there may be the abnormality in your insulin receptor. So the receptor which synthesize or secrete that insulin, so there is abnormality in that insulin. So uh, there is abnormality in that receptor, so which that receptor can't synthesize or secrete the insulin. And the second factor is pancreatic diseases. So due to the pancreatic diseases, insulin can't be synthesized by body, and due to the hormonal imbalances, so this is another factor which is responsible for the secrete or synthesis of your insulin. So these are the factors. By these factors, this diabetic third is causes, and it may also be induced by prolonged use of highly potent and toxic drugs. So this type 3 diabetes is also caused due to highly potent and toxic drugs. So some drug having highly potent activity, and some drugs having toxic effects. So this type 3 diabetes is also caused due to highly potent and toxic drugs. Then the type 4 type 4 diabetes, it is also called as gestational diabetes mellitus. So the disease may remain dominant and the symptoms may suddenly manifest it it after the some gestational period, triggered by some factors such as acute mental tension. So this fourth type of diabetes, it is caused due to some mental tension, and this is maybe treated as a proper diet only with insulin for certain period. So this type 4 diabetes, it is treated by a proper diet only or with certain insulin period. So the disease may be remain dominant and the symptoms may develop suddenly and manifest after some gestational period, triggered by some factors such as acute mental tension, and this may be treated by proper diet only or with insulin for a certain period. So in this type 4 diabetes, it is caused due to a mental tension and the symptoms develop suddenly. And this type 3 diabetes, it is treated by a proper diet or with a insulin for a certain period only. So this is all about the types of diabetes mellitus, that is type 1 juvenile onset diabetes, then type 2 maturity onset diabetes, then type 3 diabetes, type 4 diabetes. And the next point that we are going to learn is types of hypoglycemic agents. So there are two types of hypoglycemic agents are there, that is insulin therapy, that is we are taking the drug by injection, and then second one is oral hypoglycemic agent, oral and your parenteral hypoglycemic agent. So this is, we'll see first one, insulin therapy. So in insulin therapy, so first we'll see what is insulin. So insulin is a hormone. So insulin, it is mainly one of the hormone, consists of two polypeptide chain. It consists of two polypeptide chain having 21 and 30 alpha amino acid, and which are held together by disulfide, that is SS linkage. And insulin is mainly extracted from beef, that is called as bovine insulin, and pork, that is called as porcine insulin, and then purified by crystallization. Human insulin is now produced by recombinant DNA synthesis, in which human gene for human gene for insulin are inserted into E. coli to produce recombinant insulin. For example, lispro, aspart, then insulin, glargine insulin. So these are the example of your synthetic insulin. So this in insulin therapy, so insulin it is mainly one of the hormone, consists of two polypeptide chain having 21 to 30 alpha amino acids, and which these two alpha amino acid chain are held together by disulfide bond, that is the SS bond. And insulin is mainly extracted from beef, that is called as bovine insulin, and extracted from pork, that is called as porcine insulin, and then it is purified by crystallization. Human insulin is now produced by recombinant DNA synthesis, in which the human genes for insulin are inserted into E. coli to produce recombinant insulin. Example: Lispro, Aspart insulin, Glargine insulin. So this insulin is used to control the hyperglycemia. The role of this insulin is to treat it, is to reduce it, is to control the hyperglycemia in diabetes mellitus, and it is called as hypoglycemic agent. Insulin does has the role of this hypoglycemic agent is it is used to control the synthesis of this insulin, and it controls the synthesis, and it has been given by injection through the subcutaneous route, and it cannot be given by oral route, as it is insulin is a protein, and hence it may get digested by enzyme in a gastrointestinal tract. So this insulin, which is injected through directly into the skin by systemic circulation, and hence it is more effective than the other hypoglycemic agent. So this insulin is one of the hormone, and it consists of 21 to 30 amino acids that are joined together by alpha amino acid, and it having SS bond, that is called as disulfide bond. And insulin that is extracted from beef, that is called as bovine insulin, and the insulin which is extracted from pork, that is called as porcine insulin. Then it is purified by recrystallization, and the human insulin is now produced by recombinant DNA synthesis, in which the human gene for insulin are inserted into E. coli to produce recombinant insulin. For example, Lispro, Aspart, and Glargine insulin. So this insulin, it controls the hypoglycemia. It means that the hypoglycemia is the term in which the concentration of glucose increases in your blood. So the role of this insulin is to control the hyperglycemia in diabetes mellitus, and it is called as hypoglycemic agent. So this insulin does not given by so this insulin is given by injection through the subcutaneous route, and it cannot be given by oral route. And the reason behind is that this insulin is a protein, and when you are taking that insulin by oral route, so it may get digested by enzyme in gastrointestinal tract, and insulin which is a injected directly enters into the systemic circulation, and hence it is more effective than the oral hypoglycemic agent. So the insulin is prepared in a 3 different dosage form for the use of insulin therapy. So for the use of insulin therapy, this insulin has been prepared in a 3 different dosage form. So the first one is, these are the dosage form. The first one is zinc insulin suspension, and second dosage form is globulin zinc insulin suspension. Then third one is protamine zinc insulin suspension. So these are the 3 types of dosage are there, and this is the type, that is this zinc insulin suspension shows rapid acting. It comes under the class rapid acting. Then second one is globulin zinc insulin suspension. So this comes under your intermediate acting suspension. Then this third one, it comes under this long acting insulin. So for this first one, that is zinc insulin suspension, the time required for onset action is 1 hour, and the duration action for this zinc insulin suspension is 5 to 7 hours. 5 to 7 hours. And second one is your globulin zinc insulin suspension. So the onset time for onset action is 1 to 4 hours, and the duration of action is 18 to 24 hours. And the last one is your protamine zinc insulin suspension. The time for onset action is 4 to 6 hours, and the duration action for this protamine zinc insulin suspension is 24 to 36 hours. So this is all about your insulin therapy. So this it having these three types of dosage form, that is zinc insulin suspension, globulin zinc insulin suspension, then protamine zinc insulin suspension, and these are the types, that is rapid acting, intermediate acting, and long acting. And here this is the time required to show the action and time for onset action for all these three dosage form. So now this slide, in the next slide we'll see the drawbacks of insulin therapy. What are the drawbacks of insulin therapy? So the first drawbacks is the success of insulin therapy depend on purity of insulin, sterile set of syringe, and the way the injection is given. So the first drawback is it depend on the purity of the insulin. So the this insulin you are extracted from animal, that is pork insulin and bovine insulin, so it may contain some impurity. So this is one of the drawback. And the sterile state of syringe, so whatever the syringe you are using, so that should be sterile, and the way the injection is given, so that there are different methods are there to give the injection. So the this method also affect the your insulin therapy. So these are first drawbacks. Insulin therapy depend on purity of insulin and sterile state of syringe and the way the injection is given. Then the second drawback is the treatment with insulin may cause cardiovascular and renal problem. So the treatment of this insulin may causes cardiovascular and some renal problem. So this insulin may causes some cardiovascular problem, a problem in your heart system, and it may causes some renal problems. Then third drawback is the improper method of insulin administration. The improper method of insulin administration may lead to cataract and even blindness. So this is dangerous drawback of this insulin therapy. The improper method of insulin administration may lead to cataract and even blindness. So the the method of administration is important. If you're administering that insulin in a wrong way, so it may lead to cataract and even blindness. Then the next drawback is the injection of insulin, which is a protein and may cause allergic and hypersensitivity reaction. So you know that this insulin is one of the protein, and which may causes some so it may causes some allergic and hypersensitivity reactions. Then the next drawback is small benign tumor may develop. So it may develop tumors, that is called as lipodystrophy, that is called as lipodystrophy at the site of injection, which shows down the absorption of insulin. So when you are taking that insulin, so at the site of injection the small tumor may develop, that is called as lipodystrophy, and which shows down that absorption of insulin. So the develop from the development of that tumor, you can find out your insulin has been absorbed in your body. Then the next drawback is bovine and porcine insulin are antigenic. It means that they generate insulin antibodies. Human insulin is less antigenic. These antibodies bind with which decrease its effectiveness. So these bovine and porcine insulin are antigenic. It means that they generate insulin antibodies. So human insulin is less antigenic, and these antibodies bind, which decreases its effectiveness. So this bovine and porcine insulin, it generates the antibodies, and this the generated antibodies decreases its effectiveness. So this is all about the drawbacks of insulin therapy. The first drawback is the success of insulin therapy depend on purity of insulin and the sterile state of syringe and the way the injection is given. Then the second one is the treatment with insulin may cause cardiovascular and renal problem. Then the improper method of insulin administration may lead to cataract and even blindness. Then the injection of insulin, which is a protein, and may cause allergic and hypersensitivity reaction. A small benign tumor may develop, that is called as lipodystrophy at the site of injection, which shows down the absorption of insulin. The bovine and porcine insulin are antigenic, and they generate and insulin antibodies. Human insulin is less antigenic, and these antibodies bind with it bind with which it decreases its effectiveness. So this is all about the drawbacks of insulin therapy. Then thank you.